I'd like to say, firstly, how grateful I am to my honourable friend for securing this debate, and to those here who have contributed. And I think you can say that we're all pretty much in agreement about the value of our pharmacists. Our community pharmacists are a very integral part of our healthcare system. And we have often spoken in this chamber and elsewhere of how assiduously my honourable friend looks after the health needs of those on the island with its quite unique ecosystem. So once again, we are here because, as it's been said, those community pharmacies across the country, including those on the Isle of Wight, lie at the very heart of our community. And I know that everybody will agree that pharmacies play an integral and vital role in providing medicines and health advice to all those that cross their threshold. And as the Honourable Member for Halifax alluded to, she did it whilst at school, but many pharmacists have told me during lockdown, actually, it's been that they've had to develop a different relationship because the whole setting has changed and how they advise, and many of their older customers, instead of that friendly chat, they've had to help navigate their way through this new system. So that role is more important than ever in the current COVID-19 pandemic, where their sensible approach has helped spread the public health message, and I look forward to seeing them as integral to the prevention agenda. And I say this because while the pandemic continues to challenge all parts of the health and care system, local pharmacies have remained open throughout. They have been truly that front line. They've adapted to the pandemic by making their businesses COVID secure. They've innovated. They've shown immense resilience in responding to the challenges that have been brought about by the pandemic. The Health and Social Care Secretary and I, and indeed all colleagues in government, are hugely grateful for the unequivocal commitment shown by community pharmacies. And I'm immensely proud to be the Pharmacy Minister, because I would like to take this opportunity, as I have done before, to thank all those who have gone above and beyond during this crisis, helping those of our community who very often have walked through the shop door because they are frightened or because they require assistance. They have always been there. As the House may recall, last year in July 19, we agreed a landmark 5-year deal, the Community Pharmacy Contractual Framework, and it committed almost $13 billion to community pharmacy, around $2.6 billion a year. And it's the joint vision for how community pharmacy will support delivery of the long-term plan. Community pharmacists are part of our community life, and independent pharmacists account for almost 40% of the market and are integral to the success of delivering the 5-year deal and supporting the NHS. And as we've heard this evening, patients value the diversity of pharmacies and the different settings in which they act and interact with those of our community. Maintaining access to NHS pharmaceutical services continues to be a key priority for the government, and the Pharmacy Access Scheme protects access in areas where there are fewer pharmacies and higher health needs, so that no area is left without access to local, physical NHS pharmaceutical services. During this crisis, the government has put in place a financial package providing support to all businesses, including independent pharmacists. Under the NHS contractual arrangements, we've made available $370 million in advance payments to help pharmacies with their cash flow. But we've also provided additional funding for the new medicine delivery service for shielded patients to ensure that the vulnerable get their medication, and covered the cost of bank holiday openings. We are also increasing the reimbursement prices for the most commonly prescribed generic medicines by $15 million from June per month. And we have responded to concerns from the sector by pausing some work to prioritise day-to-day activities to enable an environment that rightly provides space to do the day job safely and, importantly, supports staff, health and welfare. This is particularly important given the high proportion of community pharmacy staff from Black, Asian or minority ethnic backgrounds. For example, 43% of registered pharmacists come from such a background, and we need to make sure that we provide the right environment so that everybody can keep working to their optimum. In this year's Pharmacy Quality Scheme, it comprises of two parts: an essential element that focuses solely on COVID-19 activities, including individual COVID-19 risk assessments, and a second part which will be in the usual spirit of the Pharmacy Quality Scheme. I would like to urge all community pharmacists to participate in this year's Pharmacy Quality Scheme, especially the essential element, which will reward community pharmacies for undertaking steps to keep patients and staff safe during the pandemic. As my honourable friend will appreciate, we are in regular conversation with pharmacy contractors' negotiating body, the Pharmaceutical Services Negotiating Committee, and right through the pandemic, we have met with stakeholders regularly in order that we are making sure that we have that ongoing dialogue, which is so important. We will continue to work closely with the PSNC and the NHS England and Improvement to consider what further support and funding contractors will need during the pandemic and as we move into the recovery phase. We have just entered discussions on firm proposals for additional funding put forward by the government to meet extra costs incurred by pharmacists at the peak of the pandemic. To respond to this crisis, we have a need to reprioritise certain community pharmacy contractual framework services, and the immediate challenge will be to restore those services and programmes planned for the 2020-21 period, where we can do so, and it remains the right thing to do. But I would like to stress that we will work by talking to the profession, because this has been an extremely difficult time, whereas everybody has said they have responded amazingly to the demands that have been put on them. There is also the opportunity to learn from the pandemic and facilitate changes which may have been more difficult previously. We will continue to build capacity and capability, test new services for potential future commissioning, and focus services on areas that will make the most impact to the population's health. Community pharmacies have already demonstrated how they can increase the uptake of flu vaccinations, as my right honourable friend said. And this is going to be particularly important this winter, when we know that there will be an increased uptake. And I'm really keen for community pharmacies to do more in partnership with GPs in their local area, and for them really to be as one with their colleagues and treated as other members of the entire NHS family that we value so much. And just sometimes I feel that those in community pharmacy just feel that maybe we could go a little bit further in saying that big thank you to ensure that they feel part of that valued broader network of primary care. So, I know the Isle of Wight community pharmacists are exceptional. They've won awards, indeed, for work in the past on the administration of Hep B and Hep C vaccines, and we want to consider the role of community pharmacists in future vaccination programmes to maximise access. The Honourable Lady for Halifax mentioned the loss of, or the anticipated loss of some 3,000 pharmacies. The Secretary of State at the MPA Zoom call this morning was very, very clear that that wouldn't happen on his watch, that any loss of pharmacies stopped when he arrived, because he, like me, sees the value of community pharmacists. And there are now 11,500 pharmacies across England, which is more than 12%, an uplift of some 12% since 2010. I agree with the Honourable Member for Peterborough that this period has shown the vital importance of pharmacists and the role that they play for all of us. So, going forward, the recent bill, the Medicines and Medical Devices Bill that will come to the Lords next week, will bring forward legislation that will pave the way for further consultation on what more the government can do to support dispensing arrangements and a better skill mix in community pharmacy, because we have a highly skilled workforce there that actually we could ensure that if we freed up pharmacies so that they could better use their skills for patient-facing services and thereby help alleviate pressures both on pharmacy but in primary care, it will help the whole sector and will really recognise the high skill level that we have. This will help those, including those in the Isle of Wight, to adopt innovative practices, a greater use of digital and of technology. We will, of course, engage with the sector on any proposals that we make, and, of course, any regulations in this area would indeed come before us in Parliament. But I'd like to once again thank my honourable friend for securing this important debate. I know that the coming months will continue to be challenging for Tim and for those other pharmacists that he mentioned. But I think it's really important that they know quite how much they are valued by members across this House, but mostly by their communities. And I will personally be committed to continue to do all that I can to support community pharmacies, which are an essential part of our lives, our high streets and our NHS family.